everyone. It's Kate Lamont and Kathy Kirby here from Thrive Aged Care Consultants.
Hello.
Hello, and we are jumping on to tell you about something very exciting that we are doing in the middle of the year with Occupational Therapy Australia. We are so lucky to be running a course with Occupational Therapy Australia all about a positive approach to dementia care.
Very exciting. We're excited to be working with such a keen group of therapists, and I know, Kate, you're an OT, so you know exactly how this training will be beneficial to OTs who attend.
Exactly. So for those of you who have heard of Teepa Snow, yes, she is a US OT and dementia expert, and she has developed a methodology for working with people with dementia called a positive approach to care. Now, Kathy and I have been trained directly by Teepa herself. We are certified positive approach to care teachers, and we are excited to be bringing this course to you. Now, Kath, tell us, you've worked in dementia care for a long time, over 20 years. Yeah.
I have, yes. Yes, I'm a nursing background. I've worked supporting people living with dementia in lots of different settings. So acute settings, subacute. I managed a dementia assessment unit. I've worked in aged care, and I still work in community, predominantly with people living with dementia as well. And this training, I have to say, was a game changer. And although you've been working for 20 years as well, Kate, as an OT, and I know that we've both done a lot of different dementia training over the years, and it's all great, but this was very different. And you can just see the light bulbs go off for us, for the other participants in the program in the room. And we have seen that continued on when we've delivered the training to lots of different staff. And that's allied health staff, that's students, very experienced nurses, and the outcome and the feedback is always the same, isn't it, Kate?
It is. And the reason why this training is different and that we've received such amazing feedback is, traditional training around dementia focuses on the what. What do we need to do? Okay. But we know that dementia affects everyone differently. The disease is different for people, and plus people are different. Yep. So we need to be able to think on our feet and adapt our approach. And that's what a positive approach to care does. It doesn't just teach the what, it teaches the why. What brain changes are happening for that person, and how does that affect their function, and how does that affect the way that they're engaging with you? And it teaches the how. Yep. How do you adapt your approach? And it actually has evidence-based techniques that you can apply for better connection and engagement. Yeah. So lots of light bulb moments.
Amazing. And then when those light bulbs start going off, you start to think about how you can provide care differently, don't you, Kate? And, speaking from, my nurse's hat on and carer perspective, we want to be very helpful, and we all mean well, but we tend to take over tasks because we focus on what a person cannot do. This training flips that thinking around as well, and it gets us thinking about how can we adapt our approach to support the clients or our patients, residents, to participate to their maximum ability. That's the other thing that this positive approach to care starts to focus on, which is, moving from that deficit focus to that strengths focus. And that's something that's really key as well with the new strength and aged care standards coming out. If you're an OT who supports aged care, there's a really big focus on reablement, independence, and, strengths-based care.
Exactly. And as OTs, that's how we operate. We operate in a strengths-based approach. So that's why, as OTs, we love this training. Now, Kath, I think you nailed it before. Everyone will get something out of this training. So it doesn't matter if you're an OT working in acute, community, working in aged care, working anywhere across the continuum. If you support people living with dementia, or carers of people living with dementia, this training will be beneficial to you. And I think it's also important to note, it doesn't matter what your experience is. Both Kath and I were very experienced in the field, and we've gotten a lot out of this approach. So if you're a new grad, or if you've had, quite a lot of years supporting people with dementia, you're going to get something out of this training. So we hope to see you at this training in Melbourne, run by Occupational Therapy Australia. And, we're really excited to share with you the positive approach to care way, dementia care that is different, evidence-based techniques to increase your skill, to increase your confidence, and to adapt care so that it's individualised for everyone. So look forward to seeing you there.
Yes, can't wait. Thanks, Kate. See ya.